Hello friends and dear students, welcome you all to my YouTube channel SS Pediatrics. I hope you all were doing well. आज का जो टॉपिक मैं आपको टीच करूँगी वो है विल्म्स ट्यूमर. Wilms tumor is also known as a nephroblastoma. It is a highly malignant embryonal neoplasm और जिसका नाम है Wilms tumor. It named as a Wilms tumor after a German doctor whose name is Max Wilms wrote his first medical article on this disease condition. So after that this condition is known as Wilms tumor. Near about 75% केसेस जो हमारे पास आते हैं ऑफ नेफ्रोब्लास्टोमा और विल्म्स ट्यूमर, उसमें हमारे पास जो पॉपुलेशन है दैट इज़ बेसिकली कम अंडर 5 years ओल्ड चिल्ड्रन. तो ये हमारे पास, जैसे मैंने कहा कि ये एक एम्ब्रियोनल न्यूप्लाज्म है, तो ये हमारे पास अंडर 5 एज के जो बच्चे हैं उनमें ज़्यादा देखा जाता है नेफ्रोब्लास्टोमा और दिस जो हमारे पास विल्म्स ट्यूमर कंडीशन है. और ये बायलेटरल भी हो सकता है, मोस्ट ऑफ टाइम जो है वो बायलेटरल होता है एंड सम टाइम मे बी इन सम केसेस यूनिलेटरल भी हो सकता है और ये हमारे पास किडनीज़ को अफेक्ट करता है. सो इसके बारे में इन डिटेल जानने के लिए आप मेरे वीडियो लेक्चर को लास्ट तक सुने. सो लेट्स स्टार्ट विद द टॉपिक विल्म्स ट्यूमर ऑल्सो नोन एज अ नेफ्रोब्लास्टोमा. सो लेट्स स्टार्ट विद द टॉपिक. Start with the topic Wilms tumor. Wilms tumor is also known as nephroblastoma. It is a type of cancer that starts in the kidneys. It is named after Max Wilms, a German doctor who wrote one of the first medical article about this disease in 1899. Wilms tumor or nephroblastoma is a highly malignant embryonal neoplasm that may involve one or both kidneys. 75% of the children with Wilms tumor are under the age of 5 years and most Wilms tumors are unilateral, which means they affect only one kidney. Most often there is only one tumor, but 5% to 10% of the children with Wilms tumors have more than one tumor in the same kidney. About 5% of the children with Wilms tumor have bilateral disease, means cancer in both the kidneys, and Wilms tumor often become quite larger before they are noticed. The average newly found Wilms tumor is many times larger than the kidney in which it started, and most tumors are found before they have spread to the other organs. Associated anomalies क्या है इसके साथ जो हो सकती हैं? 1% of the children with Wilms tumor having aniridia and 3% having hemihypertrophy and 4 to 5% having genitourinary anomalies or cryptorchidism, hypospadiasis or renal fusion, etc. Silent symptoms: swelling or a hard mass in the abdomen and fever, nausea and vomiting, loss of appetite, shortness of breath, constipation, blood in urea, high blood pressure, increased growth on one side of body and anorexia, pain, urethral obstruction, weight loss. Risk factors: first is the age. Wilms tumor are most common in the young children with the average age being about 3 to 4 years. They are less common in older children and are rare in adults. Higher in the African American children and lowest among Asian American children, and it is higher in the girls than in boys. It depends upon the family history. About 1% to 2% of the children with Wilms tumor have one or more relatives with the same cancer, and these children inherit chromosomes with an abnormal or missing gene from a parent that increases their risk of developing Wilms tumor. Certain genetic syndromes or birth defects: first is Weger syndrome. Weger means W stands for Wilms tumor and A stands for aniridia, means complete or partial lack of the iris, which give the color to the colored part of the area. जो आई का colored area होता है उसे हम कहते हैं iris, और यहाँ पे जो है वो नहीं होता है इन बच्चों में. And G for genitourinary tract abnormalities, which include the defects of the kidney, urinary tract, penis, scrotum, clitoris, testicles or ovaries. And R means mental retardation, Children with this syndrome have about a 30% to 50% chance of having a Wilms tumor. The cells in children with Weger syndrome are missing part of chromosome 11, where the Wilms tumor 1 gene is normally found. Children with Weger tend to get Wilms tumor at an earlier age and often have bilateral disease, means the tumor involve both the kidneys. Next are the types. First is unfavorable histology. In this, first is anaplastic. It is common in the older children and may be diffuse or local. Must have the following features to declare anaplasia. First is marked enlargement of nuclei and hyperchromatosis of enlarged nuclei, multipolar mitotic figures, which you can see in this image. Next is magnetic rhabdoid, usually seen in a very young child. Cells are with large nuclei. They metastasize to brain and lungs. Next, clear cell sarcoma, usually seen below the age of 2 years. Metastasis is to be bones. Next is favorable histology. In case of cystic nephroma, there is a localized cluster of renal cyst. Unilateral tumor होता है and always benign in nature. And in case of congenital mesoblastic nephroma, massive firm tumor and is more like hematoma on gross and histology, resembles leiomyoma. Next is nephroblastomatosis, multicentric tumor like lesions present होते हैं. माइक्रोस्कोपिकली हम इसको विजुलाइज करते हैं. देयर इज persistent immature metanephric elements and benign in nature. In case of stage 1, localized tumor totally excised, हम इसको रिमूव कर सकते हैं. In stage of 2, regional tumor होते हैं, totally हम इसको रिमूव कर सकते हैं. In case of stage 3, there is residual regional disease, positive lymph nodes और massive tumor spillage हो सकता है यहाँ पे. And in case of stage 4, there is a distant metastasis. And in case of stage 5, bilateral Wilms tumor. You can see in these pictures, stage 1, then 2, 3 and 4. Treatment on the basis of these stages. In case of first stage 1 with the favorable histology, surgery and drugs like acetinomycin D and vincristine for 6 months हम दे सकते हैं. And next, in case of stage 2 with favorable histology, surgery or radiotherapy कर सकते हैं with the drugs acetinomycin and vincristine for 15 months. And in case of stage 3 with favorable histology, we can done the surgery, radiotherapy and drugs treatment along with the adriamycin for 15 months. And in case of unfavorable histology and stage 4, we have to perform the surgery with the radiotherapy and along with all these drugs. Then डायग्नोसिस के लिए हाइड्रोनेफ्रोसिस का प्रेजेंस हमें देखने को मिलता है. न्यूरोब्लास्टोमा, मल्टीसिस्टिक किडनी डिजीज़ यहाँ पे देखने को मिलती हैं. अदर रेट्रोपेरिटोनियल ट्यूमर्स प्रेजेंट होते हैं. इन्वेस्टिगेशंस के लिए फिजिकल एग्जामिनेशन, फॉर्म स्मूथ, immobile mass confined to one side on abdomen and hypertension is present in 40% of cases. Plain X-ray abdomen and IV पाइलोग्राफी, अल्ट्रासोनोग्राफी और सीटी स्कैन हम इसे परफॉर्म कर सकते हैं. एंड यूज टू परफॉर्म दिस टू आइडेंटिफाई द एग्जैक्ट स्टेजेस, कौन से स्टेज तक जो है वो ट्यूमर बेसिकली जो है वो फाइंड किया जाता है पेशेंट की बॉडी में. सीटी स्कैन एंड मैग्नेटिक रेजोनेंस इमेजिंग, बोन स्कैन, किडनी बायोप्सी, लैब टेस्ट. In this we used to perform the urine analysis, blood and other substances को identify करने के लिए. ट्रीटमेंट के लिए सर्जरी, कीमोथेरेपी एंड रेडिएशन थेरेपी. First is removing the tumor. The goal is to remove entire Wilms tumor in one piece to prevent the possible spread of cancer cells within the abdomen. Surgeons are careful to limit the chance of this type of cancer spread whenever possible. रेडिकल नेफ्रेक्टमी इसमें परफॉर्म कर सकते हैं. मोस्ट कॉमन सर्जरी है अगर वन किडनी में ये हमारे पास प्रेजेंट है ट्यूमर, एंड प्रोवाइड्स द बेस्ट चांस ऑफ मेकिंग श्योर ऑल द ट्यूमर इज रिमूव्ड. सर्जन मेक्स एन इंसिजन. They used to cut usually down the middle of the abdomen and removes the cancer along with the whole kidney. Fatty tissue around the kidney, the ureter and the attached adrenal gland. Third is the partial nephrectomy. The goal of the surgeon tries to save some normal kidney tissue if possible, and the surgeon remove the kidney containing the majority tumor with the radical nephrectomy. And in the other kidney, a partial nephrectomy removing just the tumor and a margin of the normal kidney around it. Other option, partial nephrectomies on both kidneys. Surgical exploration. Goal is to determine the extent of the cancer and whether or not it can all be removed. तो इसमें हम आइडेंटिफाई करते हैं कि कितना लेवल तक कैंसर स्प्रेड हो चुका है और हमें कितना पोर्शन को रिमूव करना है. लिम्फ नोड्स नियर द किडनी विल बी रिमूव्ड ड्यूरिंग द सर्जरी टू लुक फॉर द कैंसर सेल्स इन दैम. The other kidney nearby the organs such as the liver may be looked at closely and suspicious areas biopsied and assessed for the other organs. Placing a central venous access device in a child to get the chemotherapy, a small plastic tube called a catheter into a large blood vessel we have to place usually under the collarbone is inserted, and the tube might be put in during the main surgery to remove the tumor or as a separate operation. The end of the tube will be just under the skin or sticking out of the chest area or the upper arm. This can be left in place for the several months to take blood samples for test and to give intravenous chemotherapy drugs and blood transfusions without having to use a needle in the arm each time. Care for the child's venous access device to reduce the risk of the problems such as clotting and infections. Complications during the surgery: there is bleeding and injuries to major blood vessel or other organs, reaction to anesthesia, loss of kidney function. Chemotherapy, use of anti-cancer drugs, vein or by mouth. Chemo drugs used most often are actinomycin D and vincristine, and also other drugs are here, and drugs are injected into a vein or into a venous access device. Assessed for the child's age and the stage of Wilms tumor. Side effects of chemotherapy: hair loss, mouth sores, loss of appetite, nausea and vomiting, diarrhea or constipation, increased chance of infection, and easy bruising or bleeding, fatigue or extreme tiredness. Nursing management: preoperative and postoperative. In case of preoperative, surgical preparation of the child and the parents. Explain the parent not to palpate the abdomen of the child. Procedural explanation: कंसेंट लेना है, लैब इन्वेस्टिगेशंस को करना है, और ड्रग कंट्रोल. पोस्ट ऑपरेटिवली वेट जो चेंज हुआ उसको रिकॉर्ड करते रहना है, इनटेक एंड आउटपुट को मेंटेन करना है, साइन ऑफ सर्कुलेटरी ओवरलोड, इन्फेक्शंस and intestinal obstruction, monitor bowel sounds, evaluate the child for the abdominal pain or distension, aseptic procedural performance, educate about the importance of continuing chemotherapy and follow-up. Prognostic factors, major factors हमारे पास हैं: hematogenous metastasis of lymph node, involvement at diagnosis and histological type of tumor. क्या है, कितना lymph nodes को इन्वॉल्व हुआ है, नहीं हुआ है, और हिस्टोलॉजी क्या बताती है ट्यूमर के बारे में. माइनर फैक्टर्स हमारे पास है: ट्यूमर का साइज़ कितना है, एज क्या है पेशेंट की, स्पेलेज ऑफ द सर्जरी एंड डायरेक्ट एक्सटेंशन ऑफ द ट्यूमर विद द इन द एब्डोमेन. सो दिस इज ऑल अबाउट द टुडेज टॉपिक, विल्म्स ट्यूमर नोन एज नेफ्रोब्लास्टोमा. आई होप आपको टॉपिक समझ में आया होगा, और ऐसे ही और टॉपिक को सुनने के लिए आप मेरे चैनल को सब्सक्राइब कर सकते हैं, एज पीडियाट्रिक्स. थैंक यू.